And we've changed our whole ER to accommodate COVID patients. Barton did a good job of putting together safety features for us. They did some HEPA filters and changed all our rooms and anything we asked as nurses to try to make us safe as nurses. They've got us PPE, which was the hardest thing to do. But I think just the level of care for a nurse and the amount of effort we need to do for each patient right now is, we tried to figure it out, as probably 1.25 to 1.5 times what we normally do. It's changed considerably, but the level, I would say the level of respect that we have for nurses is gone up. You know, nurses, firefighters, first responders. I still hear, at 8 o'clock, I still hear people hooting and hollering, which is over 6 months into this, I think. It's nice to hear, you know, we still get that support. Things have changed, you know, wearing a cloth mask and wearing this mask, and, you know, what we need to do, and even in our practice, what we do with patients. You know, we use different medications. We figured that some things work, some things don't work. And I think our outcomes have been a lot better. There's some really smart docs we work with. They do a lot of research. They do a lot of studying and trying to figure out what we need to do for patients. And I think that's changed a lot. Some of the docs have mentioned, and even some of the nurses, you know, our care and what we've done, and it kind of even made us think about how we deal with patients, how we do medicine, and kind of exhilarated some of the doctors too. You know, at 8 o'clock when I'm off on those days, I hear this people hooting and hollering and chanting, and you can hear it echoing through, you know, my neighborhood and other. You notice that people are still there, like acknowledging what you do. So it's kind of nice, because some days you go to work and you're like, wow, this is really tough, you know, but it just gives you that extra boost. You know, we were getting food and, you know, stuff like that, which is very nice. But just people saying, hey, you know, thanks for what you do. I have friends like that tell me that, you know, thank you for what you do, and I appreciate everything you do. And that's kind of nice. It kind of keeps it going.
I take care of Tahoe by making sure that my community is strong, making sure that my family is strong, and it's a good community here. I also try to make sure that the people that I take care of, you know, I always had that thought of the people that I take care of are like family. You know, what if my mother, sister, brother was in that bed? You know, how do I take care of them? And that's how I keep Tahoe strong. I keep Tahoe blue because I live here. This is my community, and I want to keep the environment clean, a nice place for years to come for my kids. So I feel safer that way, you know, educating myself, and that's what I could tell other people, is to educate themselves. Look at the scientific data. Look at, you know, what's out there, not just what you hear on the news or, you know, Facebook or whatever. Just really educate yourself and make sure you're knowledgeable. I'd like to tell the people that visit here to be respectful of the community where we are, enjoy your surroundings, you know, and make sure you're being a good steward to the land that we're on. Be respectful of the community, and, you know, I think it's great that people come up here and they feel like comfortable coming up here, but also make sure that they're, you know, admiring everything and being respectful. I think there's a connection between taking care of people and educating and having people be healthy. I got into nursing so I can help people be healthy, and I deem health as a high in my life. I try to be as healthy as possible, and I've had times where I have to educate people. I think that's what I feel like I'm an educator sometimes, and I keep on coming back to that. we're the first line, we're the front door to the hospital, we're the first that sees people. You don't know what's going on with them, and physically, emotionally, psychologically. We deal with a lot of people's needs, and it could be their worst day. And a lot of people that come up here are just trying to enjoy an environment, and then maybe that something happens that they end up in our ER. I think there's a connection between the environment and taking care of people, as far as I think it's very, very healthy to get out in the environment, and very, very healthy to enjoy the surroundings. You know, some people may not have that opportunity that we have. We're very fortunate to have that opportunity here. That, you know, taking care of people is the same thing. It's trying to make them see how being outside can be healthy.